Hello, I'm Susan Davey. I'm a PhD candidate at Monash University, and my thesis focuses on how we plan for children in emergencies. During the course of my research, it's become very apparent to me that boys and girls need different things when emergencies happen. And that's one of the reasons that I'm very excited about the Gender and Emergency Guidelines. So the National Gender and Emergency Guidelines, or GEM guidelines, endeavour to support equal rights and improve the experience of all community members during and after emergencies. The purpose of the GEM guidelines is to provide guidance to enable a gender-sensitive approach in planning for and the delivery of relief and recovery after emergencies, and they're aimed at agencies involved in service delivery in relief and recovery. The guidelines focus on gender, but can be supported by and complemented by other guidance material, including those that focus on children, cold, Aboriginal and Torres Strait Islander people, and people living with disabilities. Gender plays a large part in the roles and experience of communities in all aspects of emergency preparedness, response, and recovery. For example, gender roles in existence before an emergency become more stereotyped in the aftermath, even reverting to traditional roles of decades earlier. For example, women put themselves last to nurture family, and men are expected to protect and provide. These stereotypes limit the roles of women and men in ways that can reduce capacity for community recovery and self-care. The guidelines provide practical advice for consideration in planning for and the delivery of relief and recovery services after emergencies. Some examples include the inclusion of gender specialists, for example, women's health services, in assisting in the review of existing specific organisational emergency management guidelines, or educating emergency managers to identify and assess social and cultural risk factors, focusing on gender in the first instance. The guidelines are available on the Australian Institute of Disaster Resilience Knowledge Hub and the Gender and Disaster Pod websites. I highly recommend the GEM Guidelines checklist, which provides a structured way to review relief and recovery planning through a gender lens. If you're not already familiar with the GEM Guidelines, please take some time to explore them, along with the checklist and supporting literature review and evaluation report. Guidelines are a living document, with new sections being added as they're developed. A section currently under development is related to considering evacuation centres from a gendered perspective. The team working on this is led by Jaspreet Kaur, who's the training coordinator at the GAD Pod, and includes Chrissy Nicholson, Family Violence Prevention Officer at the City of Casey, Jade Lane, Women's Health, Goulburn North East, Steve O'Malley, Fire Rescue Victoria, and consultant Liam Leonard from the Monash University Disaster Resilience Initiative. We're joined by two team members today, Chrissy and Jaspreet. Chrissy has worked in emergencies around the world, and her current role is Family Violence Prevention Officer at the City of Casey. Jaspreet has a background in architecture and built environment and is currently the training coordinator at the Gender and Disaster Pod. So Chrissy and Jaspreet, over to you.
Thanks, Susan. As you've mentioned, we're currently in the process of developing a new section in the GEM guidelines that look at gendered evacuation and relief centres. As we all know, with climate change, we're going to be seeing an increase in frequency and intensity of disasters. And that's why it's important for us to ensure that evacuation and relief centres, which are integral to the first part of disaster response, to be inclusive and safe for everyone that comes along. The idea of a new section first came to mind after the GAD Pod was invited to attend an emergency relief centre simulation by the City of Whittlesea. During the simulation, we walked around with our current GEM guidelines to see where the gender gaps were and what they might be able to do to address these gaps. And we realised that in the first instance that there was very little that had been considered in regards to gender and people of diverse gender and sexual identities. And so from there, we realised that there was a gap in considerations that people needed to make when organising and setting up an evacuation and relief centre. So in early 2020, I was thinking of ways we might be able to expand the GEM guidelines to have a targeted, like an area that targeted gendered evacuation and relief centres. And while I was thinking of this, I was contacted by Chrissy asking if we had anything around evacuation centres and gender considerations. And so this led to us putting together a team of Chrissy, Jade and myself that would address this gap alongside support from Steve O'Malley, Rachel McKay from Women's Health Global Northeast and Liam Leonard.
Yes, I was actually contacted by our City of Casey emergency management team to ask me some questions on guidance on applying a gender lens. And specifically the question was around, well, how do we name and be inclusive in regards to toilets in relief centres? I was like, oh, good question, really great that you're thinking about it. And so I didn't know exactly the terminology to be used. So I sought the advice of the GADPod. And at that time, I started conversations with the team more generally about applying a gender lens to relief centres. You know, we know very well through COVID and any emergencies around the world that family violence increases during emergency responses and in post-emergency as well as any discrimination or inequality are just exacerbated. So we wanted to make sure that in any kind of work we do within relief settings, which are the most extreme, most traumatic side of that first phase of an emergency, that those considerations were taken into account, planned for and executed so that there was less damage done in the process. So that was where that conversation with GADPod and the City of Casey and that relationship started. And we, as Jaspreet mentioned, embarked on designing gendered guidelines for relief centres.
Thanks, Chrissy. So in the initial phase of the project, one of the outcomes we wanted to see from the project was not only a checklist and guideline, but also a case study to showcase how organisations could action the checklist and embed them within current practices. We decided that after creating the checklist, we would run a smaller version of the emergency relief simulation we saw at City of Whittlesea, and we would do this with the City of Casey as a pilot. In order to get the most out of the simulation, we split it into two parts. So the first part looking at knowledge, and the second part looking at action. In the first part, what we did was we organised a 2-hour online training session with GADPod trainers. And they talked about why it's important to consider gender during all stages of a disaster. And as Susan, you and Chrissy have just mentioned, what we see during a disaster is that we often revert back to those traditional gendered roles and expectations of women as carers and nurturers and men as protectors, which increases vulnerability and risk for both women and men. The second part of the simulation is an action workshop that we'll be holding in May. I'll pass to Chrissy to talk about this.
Jaspreet. So that gender and disasters online training was the first part, and the second part is currently in development. We're planning on running a 5-hour simulation that goes over I guess not only the reasons why gender is important to consider in an emergency at all different phases, but we're going to be discussing gender in disaster preparedness, gender in a simulation exercise where we'll be getting the teams to actually look at what current resources they have in an environment that, a place where we'll be holding it in Casey Stadium, which is where we could activate and where we do have plans for activation if there is an emergency in the City of Casey. And they'll be directly applying what they learn about the tool itself, the checklist, and the learnings from their training into setting up an emergency response in a real life setting. So it'll be interesting, challenging. We're hoping to learn as well, because obviously this is a pilot. The checklist is new. We want to see how it can be practically applied from an emergency response team and where we can make improvements. So it will be a bit of a learning for both sides. So we'll be able to get feedback from the team to look at how we can improve the checklist before we actually publish it and make it more available nationally. We'll also have a chance to reflect on previous emergencies that we've worked at the City of Casey. Sometimes we're called to other councils. So for example, Casey was called upon in the Sale fires last year. And they'll be having an opportunity to reflect on the response, but with a gendered lens. And at the end, we'll end with action planning to look at how we can actually apply a gendered lens to our disaster preparedness and any of the resources we currently have to ensure that when we do respond to the next emergencies, we're ready to go.
So Chrissy, why is it important that we look through a gendered lens when we're planning at a local government level?
Look, Susan, I think it's really important because any of the work we do, but particularly in emergency, we want to make sure that every person feels safe and welcome. And already if people are already feeling vulnerable or traumatized because of the emergency they're in, that can be exacerbated if we're not careful and applying a gender lens. So an example could be that a woman with their children have an intervention order against an ex-partner, and because of the fact that everyone has to come into the same centre, they could find themselves in the same centre with their perpetrator. So if we don't have things in place as a council in the way that we're registering people, in the way that we're putting people in different areas to sleep, they could be put at extra danger and not feel safe. And in many situations, they might go and sleep in their car or outside because they don't want to risk being in the building. So that's one example. And just in general, the people from gender diverse backgrounds who don't identify as male or female, we want to make sure that they also feel included, that there are toilets that they can access, that when they're coming in and signing forms, that we ensure that even on the form that there's options for other genders and not just male, female. So a whole range of examples that are covered in the checklist and the questions that we ask in the guidelines. They're just two examples of many, but I think highlight the importance of just making sure that everyone feels welcome, safe, and that they're able to be themselves within a really stressful situation.
It's really important that all local governments consider how they plan to keep everyone safe, especially in relief, because it's so chaotic.
That's correct. And I think that's also why it's really important that this is not something considered in the craziness of an emergency happening at the time. We need to really incorporate it in all of our design, our disaster preparedness trainings like we're rolling out at the City of Casey are going to be vital in regards to ensuring that our staff and who are responding to emergencies have that gender lens and are already equipped with the tools and resources they need to ensure an inclusive, equal response.
Yeah. So Jaspreet, what are the plans for the GEM guidelines right now?
So Susan, what we at the GADPod would like to see happen with these guidelines is to see them implemented at all levels of emergency service organisations, local government, Red Cross and various other organisations involved in disaster preparedness, response and recovery. I know a lot of people might be like, we have a disaster on our hands, we don't have time to consider gender, and we're not asking that the GEM guidelines be implemented whilst a disaster is happening. What we would like to see is these considerations be integrated and embedded during disaster preparedness to ensure we have policy and procedures in place for when the disaster does hit. And currently we're around 6 to 7 months away from fire season starting. So we would recommend that organisations start looking at the GEM guidelines now and start implementing and embedding the guidelines and considerations that they can now to ensure that when fire season does hit, we're ready to go, and all of those things are already in place. We also hope that once this section is complete, that organisations utilise it and see it as a valuable resource that they can refer back to when they're organising an evacuation or relief centre.
It could be really simple things like around menstrual hygiene that often you'd forget. And particularly if you're a man planning in emergencies, making sure that there are pads and tampons available in your relief centres. So it's not rocket science, it's just common sense, but often in planning, it's often overlooked. Mm-hmm. So it's just making sure that we shine a light on it so that we ensure that these are a part of just the way we do things, the way we operate in emergencies.
And Chrissy, in addition to your example, another simple one that doesn't take any time or effort is doesn't take any time or cost a lot is baby change tables. So during the City of Whittlesea simulation, we noticed that only the women's toilets had change tables. And so ensuring that we have baby change tables in all toilets ensures that we aren't putting the responsibility and care of a child only on the women, and allows us to move away from those outdated notions of women being the carers and nurturers.
Thank you, Jaspreet and Chrissy. I think you've given us all a lot to think about, and I absolutely concur with you that there are a lot of very straightforward things that we can do in our emergency management planning that don't take a lot of time and don't cost any money, that make everybody safer when emergencies happen. Another section of the GEM guidelines that are being developed relate to looking at the needs of pregnant and breastfeeding women. Today, we're very lucky to have Carleen Gribble with us. Carleen is an adjunct associate professor in the School of Nursing and Midwifery at Western Sydney University. Carleen, can you please tell us why it's so important that we consider the needs of pregnant and breastfeeding women?
Hello, my name's Carleen Gribble. I'm an adjunct associate professor in the School of Nursing and Midwifery at Western Sydney University. I'm just going to speak with you and share with you about some new additions to the GEM guidance around the needs of pregnant and breastfeeding women and those caring for infants and young children in emergencies. I contacted the GAD-POD a couple of years ago after the World Association for Disaster and Emergency Medicine, where the GEM guidelines were explored there. Some colleagues had attended that conference and they'd contacted me saying, listen, we've heard about this thing called the GEM guidelines, but we've noticed that it doesn't have really any content there dealing with pregnancy or breastfeeding or infant care. And we think that's a problem. So as a result of that, I contacted the GAD-POD and said, listen, do you think that you might be willing to include some information around there? Because this is really a very important issue. So obviously, in an emergency, pregnant women have specific vulnerabilities. Being pregnant can make it difficult to move from place to place. Newly having given birth, particularly if you've had a surgical delivery, can actually impact your ability to move and how the sort of care that you need in terms of post-birth delivery, but also in terms of wound management and that sort of thing. It can impact the ability to drive. So those issues that need to be considered when it comes to breastfeeding. Infants are really vulnerable in emergencies, and actually breastfeeding is something that's really protective of them because it provides them with a safe source of food and water and protection from infection. But during emergencies, it can be difficult for women to continue breastfeeding. They often erroneously believe that milk may have an impact on their milk supply, and so they'll seek to switch to formula feeding during that time. And of course, that's not a good time to do so when you don't have access to water and power and the things that help to keep our formula-fed infants safe in Australia. And especially for those who are caring for formula-fed infants, there are some real concerns because we really do rely on our amenities to keep those infants safe. And so we have had many problems in past emergencies in Australia where those who've been caring for formula-fed infants haven't been able to access infant formula, or they haven't been able to access a place to safely wash formula bottles or whatever they're using to feed their babies the milk. And so that's really something that's of enormous concern. So what do we need in emergencies? Well, we have some international guidance around that. I've been a part of a group called the Infant and Young Child Feeding and Emergencies Core Group for over a decade now. And we've developed guidance to help governments and organisations to implement emergency planning and support to ensure that those who are caring for infants and young children have the support that they need. The World Health Organization endorsed this guidance in 2010, and Australia is supposed to have actually implemented this as a part of our emergency planning as a member of the World Health Assembly. But unfortunately, that hasn't happened. And so we're in a position in Australia today where, as was seen in some research that I carried out, there's a real dearth of planning and guidance around the care of infants and young children. So the inclusion of some content around pregnancy, breastfeeding, and infant and young child care in the GEM guidance is actually an important step to raise awareness about this issue and to get organisations and governments to potentially take some of this on. So it's for everybody, really. We would like governments to pay attention. We would like emergency responding organisations to pay attention, and departments of health in each jurisdiction. And what have we got in the new inclusion in the GEM guidance? Well, having support and training of emergency management employees and volunteers so that they're able to recognise the specific needs of pregnant women, women who are breastfeeding and who have infants and young children that they're caring for. As well as, you know, not just women who are caring for infants and young children, obviously, but anybody who's caring for an infant or young child. Ensure that people are aware of what the concerns are around feeding young infants, around those worries about milk supply, and that those concerns don't necessarily indicate a need for infant formula, but they do indicate a need for support. Ensure that those who are providing aid are really aware of the specific needs and the vulnerabilities of formula-fed infants. And also just to, I guess, connect in better between the health and emergency sectors, because health is where the expertise lies in this area, but because it's not so much, it's not a medical concern, if there's a problem with feeding or even just with a normal pregnancy or post-birth, it doesn't necessarily indicate a medical problem requiring first aid, but it doesn't mean that there's not a need to have health assistance. So this is what we're looking at with the new inclusion into the GEM guidance. I'm guessing that some people will have feedback on it and will want to input into it, but I think it would be a great thing if people can have a look at it, share it amongst their colleagues, discuss it, and think about how your organisation needs to include this and what you can do to actually support this very vulnerable group. Because when you're looking after an infant or young child, it does really impact on your ability to escape an emergency. It impacts on specific vulnerabilities in experiencing the emergency, and it has an impact on recovery. So all of those things really need to be considered for this specific group. But thank you very much.
Thank you so much for that, Carleen. I personally think that it's very important that we consider the need of infants as part of our emergency management planning, because really planning for children is the focus of my own research. So thank you again. So in closing, I also remind you of the Gender Equality Act, and utilising the GEM guidelines and checklist will contribute to gender impact assessments required under the Act. Something for all of us to consider. I also encourage you to join us at the Gender Justice in Disaster Inspiring Action Conference in May 2021. For more information, go to the Gender and Disaster Pod website. Thank you.